Welcome to Dr. Roger and Friends, the bright side of longevity, hosted by three Ps in a podcast, Doc Roger, Teresa, and Danielle. Thanks for joining us for Coffee and Conversation.
We're hearing, of course, that many states are, quotes, opening up, that we're in the stage of, not my state, Massachusetts, but Florida, California to some extent. I mean, we're beginning to see things opening up. I think in California, you're going to have even, barbers and hairdressers? Do you know, Teresa? I know that's happening in Florida and Colorado. But anyway, that's sort of happening. So what does this mean? Does this mean it's all over? Well, first of all, I'd like to just set the stage. I've done a lot of reading. I'm not a virologist, and I'm not of the ilk of Dr. Fauci, even though we went to the same college. He was ahead of me there, and he's ahead of me now relative to this information. But I'd like to. There are some things that are fairly certain for those of us in public health, and that is, we are not going to be the way we interact with each other socially relative to infectious disease. We're not going to be the way we were before this for some time. I would say the earliest to even be close would be something in the area of 2 years. So things like large sports events with crowds, concerts with crowds, even smaller crowds, small meetings, say at a hotel where you go to a conference. Those things, I don't believe, are going to be happening the way they were. What it's going to require is that we have a vaccine, that we have the kind of testing that tells us whether someone is, quotes, immune. They've had the disease, cannot pass it on, they're not infectious, and they cannot get it. And when we have that information, that only comes with time, as we have studied populations who've had the disease, who have tested the vaccine, all of those things. So vaccine and testing is going to be absolutely necessary. In addition, we're going to have a knowledge of this particular virus and how best to handle it. So that's not going to come for quite a while. The vaccine, our knowledge of testing, the ability to test, and again, the whole idea of herd immunity. When we have a large part of the population, anywhere from 50 to 70%, towards the 70 is what's usually required to be safe. And when that means that a large part of our population, our herd, is immune for one reason or the other, vaccine or have had the disease or whatever, and we know that they're not going to have it. Only then we'll be able to have those things. So in the meantime, it's going to be a hybrid world. We're going to have to, even as we venture out from our homes, there are guidelines, and there's some confusion regarding those guidelines, where they're coming from. Some are coming from administration and from city and governors and that sort of thing. If that advice is in total line with public health, terrific. If it's not, then I think we have to be doing a lot of reading and finding out. So, people are still uncertain as to what to do in these next few months, actually, year and a half.
And there's so much fear already. There's been so much fear for people during these past several weeks, and to think about, going forward so differently, and that the virus isn't going to leave us. There's so much fear potentially in that thought too, and it can really dominate that fear.
It can cripple you.
Yes, it can. So I think that the challenge is our brains are constantly flooded with messages that indicate fear, and I don't see that changing. And that's true, virus or no virus. But going forward, how do we start to deal with that fear? Because we can't live in fear for the next, however long. And I think, one solution is getting just a small amount of the right information that we actually need to keep us safe, and then limiting that airtime, and then, of course, as we've said before, flooding our brains with other things that are good for us. But it's important to get the right information in the smallest amount of time. And from that information, that knowledge, we can much more easily, I think, manage our minds.
And fortunately, we have one such expert with us.
We do indeed.
So, Dr. Roger, I would love to ask you a couple questions that I have that I know people have been asking me. So, if you don't mind, I'm gonna throw a few of them out to you. So, for example,
I will try to answer them. The word expert, maybe I'm a semi-expert. As I said, there are those who study this for their job and for their vocation and for years and years. And I'm in public health, and I'll do the best I can with the answers.
Fair enough. And with a virus that we're still learning about, right? So, my question is, they talk a lot about testing. And I'm wondering, when somebody says they're tested and they're negative and they feel good, does that mean that a week from now they are not going to get it? They can get it? So there's two different tests, right? One is just to see if you have it, and one to actually see if you have some type of immunity. Could you talk a little bit about that?
Sure. First of all, this is a virus we don't know much about. We know about its sister viruses, the coronaviruses, but not this particular coronavirus. So we're learning. But the testing that we were doing, because we had no real test for this virus until it had been around for a while, all we had was a swab, which would say, is the coronavirus in your nasopharynx? So is it hanging out there? Now, we would tend to do that on people who were sick, and we would relate the two. If they're sick and it's there, we would say it's probably related to that. But there were people, of course, and that's luckily the majority, have it there, so they're positive. It's in their nasopharynx, but they're not sick. We think that those people are infectious, even though they're not sick. So that's one test. And that's helpful, but you're right. You can be negative, go out to a grocery store and be positive after that and be able to potentially spread it to others or get sick yourself. So that's sort of a snapshot that is not helpful relative to policy. What is helpful to policy is serum tests. This is measuring the antibodies. This is measuring the immunity to this particular virus. We're still developing those tests. We're still finding out what do they mean when one's positive. Does this mean you have, quotes, the free pass? Does this mean that you will never get it ever? Does this mean you can't give it to someone and that you can work and, again, be totally free of fear that you would ever get this or give it to someone? That test, we need information on that. We need lots of people tested. We need a good test. We need lots of people tested, and we need to know the behavior. And what does that data tell us? So what happens when someone is positive and we follow them? So that's going to take time for us to have a good test and analyze all the data to find out what that means for us. So again, we're talking probably 1.5 to 2 years.
There are some theories floating around out there that the virus has been in California for quite a bit longer than anyone realized. And there are theories that there is already herd immunity, but I think what I'm hearing you say is that that's just a theory until the data proves it.
Yeah, I think it's unlikely that there is yet, but it's potentially true. But again, we can't document that. That would just be an empirical observation. No one's getting sick, or many. And with herd immunity, very few get sick. I mean, that's how we handle measles and mumps. And for the longest time, very few people got it. Not everyone was immune, but very few people got it because we would vaccinate all the children. But there were a lot of adults who were potentially susceptible, and yet they didn't get it. So that herd immunity, when it's working very well, you have very, very few cases. I don't think California's there yet, but it's definitely on the downside. So that's what we're shooting for. And yet, yes, Teresa, we don't know for sure. And this is going to take lots of testing, not only the test, but analyzing the data. And next time, because this is coming back, if it acts like other coronas and it acts like other sister viruses like influenza, it will be back. We know in the 20th century it came back probably even stronger the following fall. Now, is this going to follow a seasonal thing? We don't know that either. We're thinking it probably will. And when it does, Dr. Fauci, I think, just said yesterday that he expects that it's going to come in full force in next year, and potentially even as early as this fall. And so we just have to be prepared. We have to know the enemy, so to speak, as we would say in the military. And we don't know this enemy. But one thing for sure, we will be more prepared. We had better be, the worldwide, with what we need to identify it, take care of it, limit its spread, and be able to get more data so we find out about it.
So many more questions.
Yeah.
So I'll throw one at a time, Doc Roger. So you had mentioned immunity. Can someone potentially be immune even if they've never had it? When you mentioned like there are certain DNA strands. So if I've never had it, could I potentially be somebody who doesn't get it? And if I am somebody who won't get it, would I still be able to give it to somebody else? Okay, that was two questions.
Yeah. It's immunity is a fascinating thing. There is the potential that someone could have acquired this in their nasal pharynx, maybe had minimal symptoms so that they didn't even feel sick. It was just being off. And yet their immune system identified this. And immunity means that you have cells that have this in their memory, this particular sequence or this particular virus. And if this comes back to you, gets into your nasal pharynx and tries to attack you, boom, it comes alive. It turns out a factory of antibodies and T cells to attack that. And it's so much so vigorously that you don't get sick. So what you're doing is establishing a memory. So you could have established that memory without being severely sick. I think that answers at least part of your question.
Yes.
What was the other part?
The other part is, if I am immune, can I still pass it to somebody else? Usually
not. Yeah, and in fact, you can say almost emphatically not. Our experience with other diseases where you have immunity, you can't keep it in your system for very long because it's attacked and gotten rid of and killed. And a virus that needs to be in a cell and establish itself, and the body, if there is good immunity, strong immunity to this any particular virus, it can't do that. So it's not around for you to give to someone else. So I would never say absolutely never, but for what we know about immunity, no, you usually cannot give it to someone else. So you do. This is how you would get a free pass. This is how you would open up our society to crowds when we have herd immunity and we know how to test. And if someone gets sick, then we track all of the contacts and we can make sure if they're immune, and if they're not, we can give them the vaccine or having given them the vaccine ahead of time so you can go out in crowds and not be concerned that you will get this. So that comes with time. So that's what we're shooting for, so we can return to what we used to call normal.
Yeah, and if you're saying that it's going to come back again, but our bodies develop kind of a memory to know to fight it. So if people can get reinfected, so they still have to be careful now, but potentially the reinfection would be less severe, we would hope? Is that what they're thinking?
Yes. Take influenza, a related virus. So every year it comes and usually mutates every year. It's rarely the same virus. Sometimes the mutation is very small, so effectively it's basically the same. So someone who had it last year and got sick, they either will not get it or have a very mild case. People who've gotten the vaccines over the year have a memory that every time they get a vaccination, it's every fall. It's slightly different, but that develops a family of memory, so that anything that pops into that family, you have some. It's not going to nail it completely, but you're less likely to get very sick, or maybe you won't get sick at all. So that's how this virus will be. We will develop a vaccine, and then be like flu, where it may return and return and return. But we'll have vaccines that will respond to it each time. We'll alter the vaccine a little bit just like flu. And so we will maintain herd immunity so that not so many of us will be sick, and we can go out in society without too much fear.
So where does Dr. Roger get his information?
Well, I read a lot of medical books. I listen to Dr. Fauci and other public health people. And we studied virology in medical school, but that was a long time ago, and virology has just gone leaps and bounds. So I pay attention to the public health people. I don't pay attention to the decision makers in our country. But I pay attention to the decision makers who pay attention to the public health people. But I sort of bypass and go directly to the public health people, and then what they're recommending, we may or may not get. Hopefully, we will if we have the kind of decision makers who want to do this right and protect their people. That's how it will go down. But there are strong economic pressures here. I mean, a lot of people suffering because of the economic turndown. I'm lucky. We're lucky that our lives have changed, but we're not suffering. And financially, and with loneliness for people who are alone and can't go out. So there are some pressures to push the boundaries of pure public health, and that's okay. But public health can pivot to that and give us their best advice to minimize the danger of getting this, or of people who are high risk getting it, because you can't push the boundaries so much with people who are at high risk, because they may get it and die, whereas other people may just get it. We're also finding out, aren't we, that all ages are susceptible. All ages can get it. And it's just that for sure this makes someone so sick. If you've heard people talk about how sick they are, even young people, that people who are compromised otherwise just can't handle that attack. And so they crumble. Whereas a young person gets the same attack and they're just more resilient, and their bodies are more apt to handle that assault that they get and survive. But so we have to pay attention to who's at risk, and so a lot of the policy will be regarding that too. And you all heard that's why we wear masks, to protect the other person.
And you actually touched on something. You made a really good point, because I heard on the news there are people who don't know that they have a pre-existing condition, where somebody very young in their 20s has died because they didn't know there was something going on. So as of right now, there is no free pass for people. We all kind of have to be cautious.
Absolutely. And we're, as we step out, I think we're going to get guidelines, but I think social distancing is going to continue. Unless you have a group of people who you are close to, like a family or an extended family. And we're going to have to mask. You'll be seeing masks, maybe not all the time, but you'll see a lot more masks than we saw before, which were essentially none. So masks will be a part of it. Handshaking, hugging, those sort of close, intimate contacts will be able to occur in families who are together, not families who visit from the West Coast and come visit you, and all of a sudden you just go because you just don't know. But as soon as we know who has it, who doesn't, and we begin to have that's the first thing, and how it behaves, and then the vaccine. And then be able to see herd immunity. When we have that herd immunity, then we can pretty much return to just about where we were. But that'll be a while.
You've been listening to Dr. Roger and Friends, The Bright Side of Longevity. If you like the show, please rate and review, and be sure to click to follow.